Hey everyone, Dr. Mike here and welcome to Shrekonomics. Today we're diving deep into the world of human diseases. We're not just talking symptoms, we're going all the way to treatments, prevention, the whole 9 yards. Knowledge is power, and understanding what we're up against is the first step to staying healthy. Welcome to our comprehensive guide on human diseases and their treatments. We're going to break down complex medical conditions into easy-to-understand explanations, empowering you to take control of your health. Today we'll be exploring some of the most common diseases and the various ways they can be treated or cured. We'll cover everything from the common cold to more serious conditions like cancer and heart disease. Let's get started. All right, let's start with a familiar foe, the common cold. We've all been there, that scratchy throat, stuffy nose and relentless sneezing. It's caused by a virus and unfortunately there's no magic bullet cure. The good news, our bodies are pretty good at fighting it off on their own. Most importantly, stay hydrated. Think of it like this. Fluids help your body flush out the virus, like a powerful wave washing away unwanted debris. Over-the-counter medications can help manage the symptoms. Decongestants for that stuffy nose, pain relievers for those body aches. But remember, these medications don't shorten the duration of the cold. They just make you feel a little less miserable while you're riding it out. Rest is crucial. Let your body focus its energy on fighting off the virus. Listen to your body and give it the downtime it needs. And remember, good hand hygiene goes a long way in preventing the spread of those pesky cold viruses. Now, let's talk about the flu, or influenza. Unlike the common cold, the flu can knock you off your feet. We're talking fever, chills, muscle aches, the works. And for some people, especially the very young, the elderly, or those with underlying health conditions, the flu can be really serious. The flu is caused by a virus. And just like with the common cold, there's no instant cure. But we have antiviral medications that can help shorten the duration and severity of the illness. These medications work best when started early on. So if you suspect you might have the flu, it's important to see your doctor right away. Just like with the common cold, rest and fluids are key to recovery, and of course prevention is always better than cure. Get your flu shot every year. It's the single best way to protect yourself and those around you from this potentially serious illness. Now let's shift gears to a chronic condition, diabetes. This is where your body has trouble regulating blood sugar, also known as glucose. Think of glucose like fuel for your cells. Insulin, a hormone produced by the pancreas, helps your cells use that fuel. In type 1 diabetes, the body doesn't produce enough insulin. In type 2, the body becomes resistant to insulin, meaning the insulin isn't as effective at doing its job. Both types lead to high blood sugar, which over time can damage your blood vessels and organs. The good news is that diabetes is manageable. It starts with lifestyle changes. A healthy diet, regular exercise, and maintaining a healthy weight. These changes can help improve your body's sensitivity to insulin and better regulate blood sugar levels. Medications, including insulin therapy, can also be incredibly effective in managing diabetes. Working closely with your doctor, you can find the right treatment plan to keep your blood sugar in check and prevent complications down the road. Next up, hypertension, better known as high blood pressure. This one's called the silent killer because it often doesn't have any noticeable symptoms. High blood pressure means your blood is pushing against your artery walls with too much force, putting extra strain on your heart and increasing your risk of heart disease, stroke, and other serious health problems. Lifestyle modifications are the first line of defense. A healthy diet, regular exercise, maintaining a healthy weight, and limiting alcohol intake can all make a big difference. Stress management is also important, as stress can contribute to high blood pressure. If lifestyle changes aren't enough, your doctor might prescribe medications to lower your blood pressure. These medications work in different ways. Some relax your blood vessels, others help your body get rid of excess fluid, all with the goal of reducing that pressure on your arteries. Now let's talk about asthma. Imagine your airways as tubes that carry air in and out of your lungs. In asthma, these tubes become inflamed and narrowed, making it difficult to breathe. Common triggers include allergens like pollen, dust mites, and pet dander, as well as irritants like smoke and strong odors. The good news is that asthma is very manageable. Inhalers are often the first line of treatment. These handy devices deliver medication directly to your airways, relaxing the muscles and reducing inflammation, making it easier to breathe. Along with medication, identifying and avoiding your triggers is crucial. If you know pollen sets you off, keep the windows closed during allergy season. Dust mites got you down? Invest in dust mite covers for your mattress and pillows. Simple changes can make a world of difference. Cancer, a word that strikes fear into many. It's a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells. These cells can invade and damage nearby tissues and organs, disrupting the body's normal functions. Cancer treatment is not one size fits all. It depends on the type of cancer, its location, its stage, and the individual patient's overall health and preferences. Surgery, chemotherapy, radiation therapy, and targeted therapies are some of the most common treatment approaches. Surgery aims to remove the cancerous tumor and surrounding tissues. Chemotherapy uses drugs to kill cancer cells or stop them from dividing. Radiation therapy uses high-energy rays to damage and destroy cancer cells. Targeted therapies are newer treatments that specifically target cancer cells while sparing healthy cells. It's important to remember that cancer treatment has come a long way, and there's always hope. Researchers are constantly working to develop new and more effective treatments, and many people with cancer go on to live long and healthy lives. Chapter 7. HIV/AIDS, Breaking Down the Stigma. HIV, or human immunodeficiency virus, attacks the body's immune system, making it difficult to fight off infections and diseases. If left untreated, HIV can progress to AIDS or acquired immunodeficiency syndrome, which is the most advanced stage of HIV infection. The good news is that HIV is treatable. Antiretroviral therapy, or ART, is a combination of medications that work by stopping the virus from replicating in the body. This helps to protect the immune system and prevent progression to AIDS. With ART, people living with HIV can live long and healthy lives. In fact, with effective treatment, people with HIV can achieve and maintain an undetectable viral load, meaning the amount of virus in their blood is so low that it cannot be detected by standard tests. It's important to remember that HIV is preventable. Practicing safe sex, using condoms consistently and correctly, and getting tested regularly can significantly reduce your risk of contracting the virus. Tuberculosis, or TB, is a bacterial infection that primarily affects the lungs. It's spread through the air when an infected person coughs or sneezes. Symptoms can include a persistent cough, chest pain, weakness, weight loss, fever, and night sweats. The good news is that TB is curable. Treatment typically involves a course of antibiotics taken over several months. It's crucial to complete the entire course of antibiotics as prescribed, even if you start to feel better, to ensure the infection is completely cleared. Preventing the spread of TB is important. If you have active TB, cover your mouth and nose when you cough or sneeze and wash your hands frequently. If you've been diagnosed with TB, follow your doctor's instructions carefully to avoid spreading the infection to others. Alzheimer's disease is a progressive brain disorder that slowly destroys memory and thinking skills. It's the most common cause of dementia, a general term for a decline in mental ability severe enough to interfere with daily life. While there is no cure for Alzheimer's disease, there are treatments that can help manage symptoms and improve quality of life. Medications can help improve memory, thinking, and language skills. Non-medication approaches, such as occupational therapy and support groups, can also be beneficial. Caring for someone with Alzheimer's disease can be challenging. It's important to create a supportive and stimulating environment, establish a routine, and focus on activities the person enjoys and can still participate in. Arthritis is a general term for conditions that cause pain, stiffness, and swelling in the joints. There are many different types of arthritis, but the most common are osteoarthritis and rheumatoid arthritis. Osteoarthritis is a wear and tear type of arthritis that occurs when the protective cartilage that cushions the ends of your bones wears down over time. Rheumatoid arthritis is an autoimmune disease, meaning the body's immune system mistakenly attacks the joints, causing inflammation and pain. Treatment for arthritis typically involves a combination of medication, physical therapy, and lifestyle modifications. Medications can help reduce pain and inflammation, while physical therapy can improve joint flexibility and range of motion. Lifestyle changes, such as maintaining a healthy weight, engaging in regular exercise, and protecting your joints from injury, can also help manage arthritis symptoms and slow the progression of the disease. Thank you for joining us on this journey through some of the most common human diseases and their treatments. We've covered a lot of ground, but remember, knowledge is power. The more you understand about your health, the better equipped you are to make informed decisions about your well-being. Remember, always consult with a healthcare professional for accurate diagnosis and treatment options. Self-treating can be dangerous, and a qualified medical professional can provide personalized guidance based on your individual needs. Stay healthy and informed. Keep learning, keep asking questions, and keep prioritizing your health. Until next time, this is Dr. Mike, signing off.